So everyone is exposed to light every day, whether inside or outside from the sun. Certainly, we're all staring at screens, whether it's computer, phone, TV. And a lot of people have questions related to UV light. Some people are getting recommendations and heeding them to go outside every morning and spend 10 to 15 minutes getting direct daylight to support circadian rhythm and a healthy um, circadian approach throughout the day. Is this an unsafe habit? I would say in our previous webinar with Dr. Russell Foster, there was a recommendation that you want to get that early morning light to kind of set yourself up to be aligned throughout the day and going to sleep at night when you want to. So, from an ophthalmologist perspective, is there a safe way to do that?
Yeah, and actually, a really famous person in my department here in the ophthalmology department at Stanford, I think, also is a big advocate of that morning light exposure. So, I think the first thing is the UV amount of UV light you're getting at dawn essentially is very low compared to light that's this when the sun's fully in the sky. So that's I think one I guess you know good thing to know is that the light exposure is going to be relatively low. But I think if you are trying to get that early morning light, you don't want to stare directly at the sun still, even though it's very, very low. And so um, I would, and you don't have to look in the direction of the sun either. So as long as the light is getting in your eyes, you're going to get that circadian benefit if you're trying to reset your circadian clock and march it earlier. So if you want to do this practice, I would look, not in the direction of the sun. I would look away from it, and then get your time in the sun, your 10 or 15 minutes that you're doing, and make sure you don't stare directly at the sun, and it should be safe to do it that way.
Great. That's good to know. I think that's an important thing to keep in mind that you don't want to be staring directly at it, that just getting that light exposure is plenty. In terms of light that we're exposed to indoors, some people have really adopted a red light therapy practice. I don't know if you've had any questions in your practice about this. Is that harmful to the eyes? So, putting aside whether it's beneficial or not from a health perspective or a skin perspective, what are your thoughts in terms of what it's doing to our eyes?
Well, I think most of the data out there shows that it's the shorter wavelengths of light, so the more of the blue to purple wavelengths that are potentially more damaging to the eye. So if we have to think about it from an intellectual or scientific standpoint, longer wavelength light, red wavelength light should be safer if it happens to get into your eye. I think if you are exposing yourself to these longer wavelengths, as long as the intensity isn't very extreme, it should be safe. Um, and most devices out there will adhere to national ANSI standards for light exposure. And so it's obviously a red laser pointer is still red, but it's harmful to your eye because of the strength of that laser light. So you want to use a light that's not as strong as any sort of like damaging levels.
Good to know. Just like the sun, don't be concentrating that light in your eye. In terms of light from screens, I think one of the pieces of information that I love that Russell Foster has shared with us over the years is that from a scientific perspective, they did a study looking at e-readers and delay to sleep. And while it was scientifically significant, statistically significant in terms of delay, biologically in your life, there wasn't a lot of significance there in terms of delay to sleep. And so, we tend to get really worked up about things. And I think people are ever mindful or increasingly mindful of screen time, whether it's their phone, computer, whatnot. How damaging is that screen light to your eyes? Maybe it's not so damaging in terms of sleep, but is it damaging? And do the yellow lenses that some people have adopted, I think they're quite popular among engineers, for example, are those helpful at all?
I think it's important to kind of break the light exposure from screens and phones and computers into two different things. I think the actual light itself is not physically harmful to our visual system, um, but I think it could affect um, different areas of visual performance. So there's eye strain, so our ability to kind of like mitigate the fatigue that we get throughout the day. So if you're in front of the screen for 10 to 12 or 15 hours a day working, and the light will wear on you because it's kind of a stressor to your body, and so wearing lenses like the yellow or amber lenses, which blocks out the shorter wavelength, the bluer light, could potentially help kind of soothe your eyes and help them to relax and have resilience against fatigue from just using your eyes all day long. So I think there's a benefit from that. I think also that um, the again the shorter wavelength bluer lights could also potentially affect your circadian rhythms, even though maybe it's controversial. But I think if you don't have trouble going to sleep or falling asleep or staying asleep, then reading your phone in bed at night before you go to sleep probably isn't a problem. But if you are someone has insomnia, you have trouble falling asleep, and and you're still using your iPad or your phone, up until you try to go to sleep, that's probably not the best thing to do. And you have to start doing all these great sleep hygiene things of, winding down and, dim lighting and no screens, no computers, no phones, no e-readers in the hours leading up to sleep. And, I think you need to go through that kind of process to try to help with that insomnia. But for your average person who doesn't have those issues, I don't think using any devices before you go to sleep is harmful. There is also a component of dry eye. So when we look at a screen or a phone, we don't naturally blink as often as we do when we're not using these objects and we're outdoors for a walk or just doing normal things like having a face-to-face conversation with someone else. So we actually blink a lot less often when we're on a screen than we are when we are talking to people or not using these devices. And so the fact that we're not blinking so often leads to surface dryness, and that can cause blurry vision. It can cause eye strain. It can cause pain. And so taking breaks when you're on a screen um, is very important. And there's an easy thing to remember. They call the 20-20-20 rule. So every 20 minutes, look somewhere 20 feet away or longer for 20 seconds. So it doesn't have to be a long break. It's just a very short break, 20-second break. Look into the distance, and that kind of helps reset your blinking mechanism and allows your eyes to relax too. So we're not focused up near, which can cause a spasm in the eye. And that will keep us comfortable and keep the surface of the eye healthy as we're using all these devices.
To that end, in addition to looking away every 20 minutes, looking at something 20 feet away, do the accommodation exercises help too if you're able to incorporate that like once throughout the day? Is that going to be helpful?
I don't think for most people those exercises would be helpful because I think it's accommodation actually that's causing the fatigue. So you want to not be looking up near when you're relaxing. So looking farther away, eliminates the accommodation. So I think the accommodation exercises are mostly used actually in usually in pediatric patients who have issues with their eyes alignment, and doing those accommodation exercises can help realign the eyes. But for your general population, I don't think doing any sort of accommodation exercises are needed.